Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
Hello and welcome to this special presentation of Health Insurance Open Enrollment Get Answers. I'm Mitchell Lewis, and today we will cover several items that you, the consumer, need to know before selecting your open enrollment health insurance plan for the upcoming year. First, we'll discuss the ways costs can be controlled by you, the consumer, in your health care needs. We will also look at how your company insurance plans may be changing for the upcoming year and what you need to know before selecting a level of coverage. We'll also look at the Affordable Care Act policies and how to enroll as an individual or as a small business. We will also check out different ways to plan for health care costs. And we'll go over some of the main terms that are used in health insurance. All this information is available on our website. That's unctv.org/healthinsurance. Now, we want to welcome our panel of guests today who will be helping us answer the basic questions of health insurance open enrollment. We have from Get Covered America, Sorian Schmidt. So Sorian, tell us, what do you do?
Well, I'm the North Carolina director for Get Covered America, and we go into communities across North Carolina and talk to consumers who may be looking to buy insurance for themselves and their family members, and we inform them about how the federal ACA health insurance marketplace works and where they can go to get help and financial help both and in-person assistance.
We also have Jordan Capps from the Marsh & McLennan Agency. So what do you do for your agency, sir?
Well, thanks for having me. I'm the Senior Vice President based here in the Triangle, and we work with organizations of all sizes, actually across the country, but certainly have a concentration here in North Carolina. And so whether that's small businesses all the way up through institutions of significant size, we're looking at their benefits needs and how they can offer meaningful benefits to recruit and retain their employees and address the financial needs that they have in those situations.
We also have Sherry Hay from UNC Family Medicine. And Sherry, I know you wear many hats when it comes to UNC Family Medicine.
I do, and thank you for having us, Mitchell, for this important topic. At UNC Family Medicine, I work with our community health initiatives, which includes a broad range of topics from helping people with their chronic disease management to helping them with the Affordable Care Act, where to get assistance, how to know where the numbers are and where the assisters are. So we're really there to support people in understanding their benefits and using them wisely.
And last but not least, Mary Willoughby from Blue Cross Blue Shield of North Carolina. What do you specialize in?
So I've been at Blue Cross for about 6.5 years, and I work on our Affordable Care Act enrollment team, which is primarily focused on the individual market, so people who buy their own health insurance.
And thank all of you for being here. Now, what are cost measures that consumers need to know about? Now, for many consumers, a trip to the doctor is a painful thought, especially when it comes to the costs associated with it. But there are ways to help control how much you need to spend to get the quality care you need, and the hospitals and insurance industries are trying to teach consumers what is the best way to get the help within the system without overspending. So, Sherry, I'll start off with you. What are some of the ways that UNC is trying to educate consumers?
Well, UNC, along with other healthcare systems across the state, are very interested in people getting the right care at the right place at the right time, and of course the right cost. And what contributes to that is uncompensated care for the uninsured. So we encourage people to get coverage. And the second thing is understanding and using those benefits wisely, which includes, and services, which includes a variety of things as well. So how do I use and pick a plan and decide about what's good for me and my family. It's so personal, and we try to support patients and consumers in that. And then also around the service utilization, we really encourage people to talk to their physicians about, when do I use the emergency department? When do I come to your office for care? So really understanding those nuances of benefits and using services. It's so important to not only use it for patient experience and to increase that, but to also really help with that cost issue.
And Mary, of course, you've got many consumers. What are some of the things you're trying to educate them on?
We do. We have a host of tools available to members who can look up how much it costs to go to different places. We also have a nurse line that is open 24 hours a day, 7 days a week, where people can call to try to determine which the appropriate place of care is. We promote our networks a lot so that individuals know that they're visiting a doctor or a hospital that's in network. It's significantly lower costs if you visit in-network providers as opposed to going out of network.
And of course, what are some of the ways or other ways consumers can control their health care costs, especially for planning for the upcoming year of enrollment?
One thing I would say, Mitch, is that it's very important as soon as somebody has selected a health insurance plan to look at which doctors work with that plan and pick a doctor before they have an emergency and go visit that doctor for a healthy checkup. We have found a lot of people that are buying their own plan for the first time may not have gone to the doctor a long time, and when they go, they might find they have a new condition they didn't know they had, and they can get treatment in advance before it becomes an emergency. And so that's very important. And then they have that resource of that doctor's office to go to ask about their health insurance, to get help understanding it, but also to go there to ask, where is the right place for me to go for this treatment, or if this situation occurs to me or my family. So I think planning ahead in terms of going when you're well to a doctor and picking a doctor before you're sick and in an emergency is really important.
And also making sure that you have a plan in place.
Yes, getting enrolled is critical, and we're entering open enrollment periods for the health insurance marketplace. And when people, and Sherry's mentioned this, that when people are looking there, they want to talk to an expert, an agent, a broker, or a federally funded assister. They're available all over the state, and find out which doctors work with each plan so that they can pick the plan that includes doctors they want to go to.
For those consumers who work at a company that offers insurance benefits, it's important for you to pay attention to what you're signing up for each year. Some plans that have been in existence for years may now be changing or not being offered anymore. So during this open enrollment period, it is wise to review all of your policies that are available to you. Now, Jordan, I'm going to get you into this conversation now. So, you know, this year, a lot of people are noticing that their plans are changing. Is this something that's new, or has this been going on like through the years and you just didn't notice it until now?
Plans are certainly changing. I would say that it's been ongoing. Those that are noticing some of the significant changes might be a result of more out-of-pocket costs. And so one of the things that consistently comes up with employer coverage is that balance between what will the employer pay and then what will the employee and the family be responsible for. And so we're seeing a shift in some of that cost more towards employees. And if they haven't seen that before, this is a likely change for them to see in 2017. Also pharmacy, there's going to be a number of changes for prescriptions. And so when people are looking at the cost of care, it's not just going to the doctor, but also how they're going to pay for that, for the prescription that they're going to get after that visit. And so for them to look at the specifics of the plan, to talk to an HR manager, to talk to somebody that's providing that education is very important, because it'll help them understand their cost up front and then ongoing throughout the year.
Now, as consumers go into these plans, what should they take into account? Because you've mentioned some things already, but if you had to really point out major keys that consumers need to take into account when choosing their plan, and especially when it comes to the overall cost of the plan, what should they be considering?
So many employers have a couple different options. And so they'll have maybe a base plan that's a high deductible plan. And what that really means is that the employee and their family will pay more up front when they receive care. And so when they go to the doctor, it's not just a copay, a $25 copay or something like that. They'll be paying possibly a couple $100s to see the physician up front. But then after they spend up to that deductible limit, that's when the plan starts taking on more of those expenses. And so there are really two different types of plans, and consumers need to know whether they're in a high deductible plan or a copay plan. And sometimes you can pay a little bit more in monthly premium and buy up to that copay plan. And so for them, that's probably going to be the biggest determinant in their out-of-pocket costs, and that will help them plan the financial impact for the coming year.
Which you're sort of touching on my next question, because what is the difference, say, between a normal PPO plan and a consumer-directed health insurance plan?
Sure, and so the PPO plan really is going to be one that's based on that copay structure. And so you go to the doctor, or you go and you have a generic drug, and you kind of have that fixed small amount that you pay for each of those services or each of those prescriptions. The high deductible plan, the patient really is paying the cost of that care. And so one of the things that's good about that is for those who think that they might have lower costs, that's one way for them to pay lower premiums and then just pay for the care that they actually need. So that could be a good way for people to control their costs that way. Also, it's good because people actually see the cost of care, and people can make more informed decisions about where they receive the care.
Mary, go ahead.
I was just going to add, I think another thing important for consumers to think about is some of the things Sorian mentioned were your plans, your drugs. Are you on a lot of medications? Is your physician in the network? But also, how do you use services? Do you have a chronic condition where you think you may need to go more frequently? So back to the deductible plans and whether that out-of-pocket is important for you and your family is, are you going more frequently than, say, someone who doesn't need that type of frequent visit? So that's really important to act early, get assistance, and really plan for what you need ahead of when you need it.
Mary, anything to add to that?
I completely agree with everything that everyone has said. I think in the individual market, as Jordan pointed out, since employers contribute to plans, the employee choices are more limited than in the marketplace available at healthcare.gov and on our site. But those individuals, I would encourage to really spend some time thinking about how they utilize their health care, where they go to the doctor. We're lowering copays all over across the board on our individual plans. So we encourage people to go proactively have that visit and better coordinate their care. Certainly want to look at the premiums and the out-of-pocket costs. So both of those are key pieces.
And in talking about, say, the private exchange, are there any options on the private exchange for health insurance coverage?
For Blue Cross, we're offering the same plans to individuals both on and off the exchange. So if they come directly to our site or go to healthcare.gov, they will see the same set of options. The difference being that on healthcare.gov, they can access financial assistance from the federal government, so they can access help with their premiums and or help with their cost sharing, so the member responsibility of the plan. Sometimes some people within certain income ranges qualify for additional assistance.
As you go through the year, sometimes things change. Are you able to make changes in your plan throughout the year?
You are. Certain changes are a qualifying life event that entitles a person to a special enrollment period outside of the open enrollment period. There's a list of almost a dozen of them. I'd encourage people to review that list, but some of them are, for example, a permanent move to a new service area where different plans are available or your plan may no longer be available, or a marriage that qualifies you for a special enrollment period as well.
So I would add, within the context of an employer plan as well, it's very important if you have a kid and you want to add your new baby to the plan to make those kinds of updates throughout the year as well.
How do you find a health insurance plan that fits your budget and meets your needs? A good plan protects you and your family at a price that's right for you. You can feel safe knowing that all Marketplace plans cover a core set of essential health benefits, like checkups, having a baby, emergency care, prescription drugs, and more. Most Marketplace plans must also include free preventive care, like shots and screening tests. And don't worry if you have a pre-existing condition. You'll see the same plans at the same cost as everyone else. You can't be denied coverage. Here are a few things to think about before you look at health insurance plans. Health insurance is a contract between you and your insurance company. You buy a plan, and the company agrees to pay part of your medical costs when you get sick or hurt. Although all plans in the Marketplace cover a core set of benefits, the amount you'll pay will be different from plan to plan. In general, if your monthly premium payments are low, the cost of getting care, or how much you'll pay out of your own pocket for things like prescriptions or hospital stays, will be higher. And if you pay more each month for your premium, those other costs will be lower. Finding a good health plan means balancing how much you pay each month with how much health care you think you and your family are going to need during the year. If you're healthy and don't go to the doctor very often, then a plan with a low monthly premium will probably cost you the least. But if you need to go to the doctor a lot or you need a lot of expensive prescriptions, you should look at plans where the cost of getting care, or how much you'll pay out of your own pocket, will be lower. If you really need a lot of health care, spending a bit more on your monthly premiums will actually save you money in the long run.
We've been hearing about it for the last few years. So what is the Affordable Care Act, and how is the program set up for people who need insurance coverage? Sorian?
Well, the Affordable Care Act actually implemented many reforms that have been going into place since 2010. But specifically, I think what you're referring to is the health insurance marketplace. And every year there is a period where everyone can go and check. It's called the Open Enrollment period. This year, the Open Enrollment period begins on November 1st. And will end on January 31st of 2017. So people will have that 3-month window to apply for health insurance on the marketplace. And in the case of the Affordable Care Act marketplace, people are purchasing health insurance individually for themselves or their family members. And there's a great deal of help available to them so they can understand it better. So we've mentioned many terms here: networks and premiums and deductibles and out-of-pocket costs. And so I very much encourage, this can be confusing to people, so I encourage everyone who thinks they may need insurance and want to explore whether they qualify for it to go to healthcare.gov directly themselves and look, but also to call and find an in-person assister in their community. And we're very lucky in North Carolina because you can call one phone number to find an assister for you in any county of the state. And so that number is toll-free, 855-733-3711. Or you can go to our website, which is getcoveredamerica.org, and you just click on Find Local Help, and appointments will pop up right there, and you can schedule yourself into one. And the assisters will sit down with you for an hour or 2 hours and walk you through the process. Mary mentioned you're doing two things at healthcare.gov. You're shopping for insurance and looking at what plans are available to you. And the second thing you're doing is you are putting in your personal family information and applying to see if you qualify for financial help to pay for your plan. And 90% of the people, or actually 92% of the people in North Carolina who are enrolled in marketplace plans now are getting financial help to pay for them.
The world of health insurance can be confusing, but we're here to help with information on how to sign up for the health insurance marketplace. To get us started, here are some general tips about the marketplace. The marketplace is for people without health coverage. This means that you don't have any coverage through your job, Medicare, Medicaid, the Children's Health Insurance Program, or any other source that could provide you with coverage that the government deems to be acceptable. What you pay for insurance with the marketplace depends on your income, and you'll most likely save with a new marketplace plan compared to what you are spending now. You can apply for coverage in 4 different ways: online, on the phone, mailing in an application, or in person with a local assister. And finally, if you don't have any health insurance, you may have to pay a fee, so make sure to check out healthcare.gov for all of your options. Make sure to take note of important dates and deadlines before you apply. Open enrollment begins on November 1st, 2016, and continues until January 31st, 2017. However, if you wish for your coverage to begin on January 1st, you'll need to enroll by December 15th, 2016. If you miss the January 31st deadline, it isn't necessarily too late to get coverage with the Marketplace. You may qualify for a special enrollment period. Go to healthcare.gov for more information. In order to better prepare for your application, try to gather as much relevant information as possible from the checklist that healthcare.gov provides. Some of the details include information about your household size and how many people you want to put on your plan, all of the applicable Social Security numbers for those people, gather any document information on legal immigrants in your household, take note of how you file your taxes, plus many other details. Be sure to look at the full checklist on healthcare.gov. Now, most importantly, there are 4 different ways for you to apply for Marketplace coverage. You can apply online at healthcare.gov. You can start your application as soon as enrollment opens on November 1st, 2016. You can apply on the phone. The Marketplace call center is open 24 hours a day, 7 days a week, and their number is 1-800-318-2596. If you wish to fill out an application in person, go to healthcare.gov and enter your zip code to find a certified assister who works near you and can help you through the process. And lastly, you can mail in your application. The paper application can be printed off of healthcare.gov, and your eligibility results will be sent to you approximately 2 weeks after you send your application in. It's a complicated process, but there are lots of resources that can help you get covered. Go to healthcare.gov or call 1-800-318-2596 with any questions.
Now, what are the situations where people can find out if they can get assistance?
Well, anybody who is uninsured or has family members who are uninsured should make an appointment with an assister and find out what they might qualify for. There are certain people who the law had intended to be covered by Medicaid who may have such a low income that the system is not set up to be able to pay enough to help them so they could afford it, and they may be exempt from getting insurance. But anybody who could qualify for health insurance and financial help on the Marketplace or has a higher income and could pay for it themselves is required to have health insurance and could potentially be fined if they qualified for help and didn't take it and remained uninsured for the year.
So, Sorian, you were saying that people who have low incomes may not be eligible for subsidies. What did you mean by that?
The Affordable Care Act gave states the option to expand Medicaid to cover adults with incomes under the poverty level. And North Carolina chose not to expand Medicaid. So people with very low income, like I said, less than poverty level, may not qualify for enough subsidy to purchase a plan on the Marketplace and may not qualify for any Medicaid coverage either. And so those are mostly adults. And they would not be subject to a fine then. But everyone who's not sure if they have enough income should go see an assister at our North Carolina call center. They can make the appointment, like we said, and should make that appointment to make sure about what they qualify for. Even if they as an adult don't qualify for Medicaid, their children very well might, because children qualify for more assistance at higher income levels than adults do.
And remind us the deadline processes for the Affordable Care Act.
Yes, everyone can check to see if they are eligible for financial help and a health insurance policy on the Marketplace starting November 1st, and they have until January 31st to enroll. So that 3-month period is called open enrollment. For people who are renewing their plan that they have this year or re-enrolling in a new plan, they really should do that before December 15th so that they can have no gap in coverage and they can start their plan starting January 1st, and so that they get the right financial package to pay for it.
So now we're going to take a quick look at the levels of plans that are available on the Marketplace.
It's time for you to pick a health insurance plan with the marketplace, but how do you know which one to pick? Here are some things to think about before choosing. There are 4 metal categories to pick from: bronze, silver, gold, and platinum. These categories demonstrate how you and the plan share costs. This does not reflect the quality of provider care. You should figure out your total current costs for healthcare before choosing. You currently pay a monthly bill as well as personal costs when at the doctor. You should make sure to understand how much you pay now before selecting a plan. And you should also try to understand plan and network types: HMO, PPO, POS, EPO. Know that some plans allow you to use almost any doctor, while some will limit your provider choices. Let's explore the metal categories. You pick whichever plan you want based on the shared costs, not based on the quality of care. Pick the one that is right for you and your financial situation. The bronze category has the lowest monthly premium, but has the highest costs when you need care. This is the best choice for you if you want a low-cost way to protect yourself from major medical scenarios, but you will need to pay for most routine care out of pocket. The silver category has a moderately priced monthly premium and moderate costs when you need care. This is the best choice for you if you are willing to pay a slightly higher monthly premium than bronze to have more of your routine care covered. The gold category has a high monthly premium but low costs when you need care. This is the best choice for you if you are willing to pay more per month in order to have fewer costs when you need medical treatment. And the platinum category has the highest monthly premiums of the 4 types, but it also has the lowest costs when you get care. This is the best choice for you if you use a lot of care and are willing to pay a high monthly premium while knowing that nearly all other costs will be covered.
It's not just individuals who are looking at policies in the Affordable Care Act marketplace. Small businesses are also able to sign their employees for coverage. So, Sorian, what are some of the things that small businesses need to know about in signing up for the Affordable Care Act?
I think the way the small business market, the shop market has worked has not led to a lot of small businesses going there. Many of them are still purchasing plans off the marketplace. The marketplace is intended to help people that are 50 or fewer, not for companies that are bigger than 50 employees. And again, just like with individuals, I encourage them to go to an agent or broker to see if they can get help understanding what all their full options are on and off the marketplace.
If you're a small employer looking for health insurance, look no further than the SHOP Marketplace. The Small Business Health Options Program, or SHOP Marketplace, is where small businesses find and enroll in affordable, flexible health insurance for their employees. We make it easier for small employers to offer high-quality health and dental coverage to employees. You may even qualify for a special tax credit that'll lower what comes out of your pocket. Here are some quick tips about the SHOP Marketplace. It is specifically for small businesses. It's generally open to employers with 50 or fewer full-time employees, including religious and nonprofit organizations. And you can start offering coverage any month of the year. It's online and available when you are. Healthcare.gov has dozens of resources to learn more about eligibility, tax credits, and coverage options, and lets you enroll and manage your coverage any time of day that works for you. It puts you in control. You decide how much to contribute to premiums, when to start enrollment, and how you want to offer coverage, like a single plan or choice of plans. Providing health insurance is an important business decision, and the SHOP Marketplace helps you make the best choice for your business. Registered agents or brokers can help you evaluate your options, choose a plan, complete your application, and manage your enrollment. This is all at no additional cost to you. Visit healthcare.gov to find a SHOP Marketplace registered agent or broker to get personalized support and help today. Ready to shop? Go to healthcare.gov/small-business and get started. As a small business or nonprofit, you may be eligible for the Small Business Healthcare Tax Credit, giving you the chance to put money back in your pocket. You may qualify for this tax credit if you have fewer than 25 full-time employees. Provide an average salary of about $50,000 a year or less. pay at least 50% of your full-time employee-only premium costs, and offer coverage to your employees through the SHOP marketplace. The tax credit is highest for companies with fewer than 10 employees who are paid an average of $25,000 or less. The smaller the business and lower the average wage, the bigger the credit. Still not sure if you qualify? Check out the Tax Credit Estimator on healthcare.gov to find out if your business may be eligible. Or call the SHOP call center at 1-800-706-7893. Ready to shop? Visit healthcare.gov/small-business.
Well, I'm going to throw this question out to all of you, and perhaps I can get an answer from one of you, but how will consumers who were part of other company plans this year be affected by the insurance companies leaving the Affordable Care Act?
So CMS is going to place customers of those plans into a new plan available in their area. For those members who are coming to Blue Cross, we do have a website available to them that's bcbsnc.com/here4you that consolidates information such as network information, find a drug, other plans and benefits data that I think will be helpful. They can certainly go out to healthcare.gov and check out their options, but they will be placed into a plan and we'll proactively reach out to them once we're able to.
And of course, we've been hearing a lot that if you don't participate, that there are penalties involved. What are the penalties for those who don't enroll in the plans?
Just to add also to the earlier, for individuals, as the marketplace is changing in terms of their options, do go and look and see what might be available to you on healthcare.gov in terms of the assignments. So again, acting early is important. There is a penalty involved for individuals, and it is based off of either a percentage of income or a flat fine, depending on which is greater. So we don't want anyone to be penalized. Get covered, go look at your options, and it really depends on your income and depends on your family size what that penalty is. It can range as much as $695 for an individual up to more for a family. So check out those options and act early to avoid that penalty and to get covered.
Yeah, because that would be interesting to have to pay a penalty and still have to get the coverage. So.
Yeah, be uninsured. I think it's $695 per adult that is uninsured in your family. So you could have multiple adults that are subject to the fine because they could have gotten help online on the healthcare.gov. So much better to check. In terms of the companies that are leaving, United and Aetna are leaving North Carolina's marketplace, and Cigna is coming in new. And that changing of providers in the marketplace does happen from year to year. So again, we encourage everyone, they will be getting letters if you had been with United or Cigna, or United or Aetna. You will get letters from the federal marketplace telling you that there's a new plan out there that we think is similar that you might want to check out and that we'll move you to if you do nothing. We really, really highly encourage people to actively look at all the plans available. On average, even if you only have Blue Cross plans in your county available to you, you're still going to have multiple plans that you can choose from, and you want to make sure that the plan you pick is the one that's best for you based on what you know about your own health needs and your budget. And the federal government doesn't know you individually. They're just looking at the plans generally, and they're going to say, oh, this United plan looks really similar to this one Blue Cross plan, so we're going to take everybody on that United plan and move them here unless they tell us to do something different. So we really want people that have to move from insurers, and really everybody who's already enrolled this year and needs to re-enroll for next year, to go look at the options, because the plans and the prices change every year, and they want to pick the best one for their personal needs.
Now, in addition to you panel of experts, we've also received questions from people online, and here's one, and I'm going to address it to you, Sorian. A viewer had written, I read that insurance premiums are going up. We've been talking about that. Will plans be too expensive for me to afford?
That's a very good question. There's a lot of news that covers rate increases that may be occurring in individual plans or even employer-provided plans. On the individual marketplace, as I said earlier, 92% of North Carolinians getting a plan there are getting help paying for it, and that financial help increases when the rates increase. And so everyone, whether they're getting a plan now or they're coming in for the very first time, needs to go to healthcare.gov, update their information so they get the most up-to-date financial package available to them, and so that they also can choose between the different options and plans so they pick the right one, both for their health needs and their budget needs.
Now repeat that again. Where can consumers go to find out or to get help with plans for the Affordable Care Act?
Right. You can go directly to healthcare.gov, which is the marketplace, or you can go to call the North Carolina call center to get an appointment with a free expert assister in your county, and that number is 855-733-3711.
Now, you may not be able to completely predict all of your upcoming healthcare costs, but there are ways to prepare for some issues. Now, one way to plan for healthcare costs is to open a health savings account or plan. You can think of this like a personal savings account that you have at your bank that holds money that is set aside that can be used to pay for healthcare costs down the road. Here's a quick video that goes over 3 of the types of health planning accounts.
There are several types of health savings accounts. First, the flexible spending account. A flexible spending account is set up through your employer plan, and it can allow you to set aside pre-tax dollars for certain health and dependent care needs. For example, the money can be used to pay for deductibles, prescription copays, and other treatments not covered by your insurance. A big downside for many, though, whatever you don't use by the end of your company's benefit year will be or can be forfeited. You need to check with your employer's Human Resources Department for specifics on their FSA. They can provide a list of FSA qualified costs that you can purchase directly or be reimbursed for. A health savings account, or HSA, is a tax-preferred savings account available to those enrolled in health plans. Employers and employees are allowed to contribute to them. HSAs allow you to set aside tax-free dollars to pay for routine, out-of-pocket health expenses. You also pay no federal taxes on interest earned by your HSA as long as you use the money to pay for eligible medical expenses as defined by the IRS. Dental and vision are included. Unlike an FSA, an HSA funds roll over annually and accumulate even if an employee changes jobs. The accumulated funds can be removed for non-eligible expenses, but then will be subject to federal income tax and a 20% penalty. Once an individual qualifies for Medicare, these accumulated funds can still be used tax-free for medical expenses Medicare doesn't cover, or they can be used like an IRA or 401k. A health reimbursement account, or HRA, is an employer-funded group health plan for which employees are reimbursed tax-free for qualified medical expenses up to a fixed dollar amount per year. Unused amounts may be rolled over to be used in the next year. The employer funds and owns the account. Health reimbursement accounts are often called health reimbursement arrangements.
Now, the video talks about the ability for the health savings account to roll over to the next year. Now, is this true for all types of plans, Mary?
It's not. It's only applicable to the health savings account. The FSA, the flexible savings account, must be used before the end of the year. A health savings account does have to be tied to a specific type of plan, generally a consumer-directed health plan or a high-deductible health plan. We offer one bronze plan that is HSA eligible, health savings account eligible, and one bronze plan that is not. I know the rules for employer groups and what they offer can be different.
Right, and so you could see a scenario where as long as there's a deductible for at least $1,300 for an individual, that could be a plan that's eligible for an HSA. And so within that context, it'd also be important to know if your employer is contributing to that and the tax advantages of doing so. Those plans usually have lower premiums, and so it provides the opportunity for individuals to contribute to that account and kind of stock away savings for a rainy day, so to speak, because it can be used in future years. So you can take that money and contribute it before taxes, and it can grow in that account tax-free, and then it can be spent in future years tax-free as well. And so there are strong tax incentives to help make that plan and make that money as efficient as possible.
So if I were considering doing this, what would be some of the key points you would suggest to me in order to find out what would work best for me?
Well, I would look at how much money you're saving by participating in the high deductible plan, and then consider how much you might be able to contribute. Look at some of the costs that you might expect to incur as you seek out care, and try to put away enough to cover those costs. And then those years where you're not spending that can be saved, and it can grow year to year so that you have it in the future.
Well, anytime you talk about health care or health insurance, there are terms that are used that sometimes are hard to understand or need clarity. So we're going to try to explain some of them here in this program. First of all, coinsurance. Now, this is the amount that you must pay for covered services after the deductible has been met. For example, if a policy pays 80% of covered charges, then your coinsurance amount will be the remaining 20% of covered charges. Copay. Now, this is the fixed dollar amount that you pay to your provider each time you get medical care. For example, you may be charged a $20 copay when you visit your primary care doctor. Deductible. This is the initial out-of-pocket amount that you owe for health care services before your plan begins to pay. Now, for example, if your plan deductible is $1,000, your plan will not pay anything until you meet the $1,000 deductible for covered health care services subject to the deductible. The deductible may not apply to all services. Network. Now, this includes the hospitals, doctors, healthcare suppliers, and facilities that your health plan has contracted with to provide health care service. Premium. This is the amount that must be paid for your health insurance plan. It's typically paid by you or your employer. Out-of-pocket limit. The most you pay during a policy period, usually a year, and this is before your health insurance or plan begins to pay 100% of the allowed amount. This limit never includes your premium, balance billed charges, or health care that your health insurance or plan doesn't cover. Now, some health insurance or plans don't count all of your co-payments, deductibles, co-insurance payments, out-of-network payments, or other expenses toward this limit. Now, we have a full list of terms and their meanings on our website and links to more information from our program. Now, as I mentioned before, we do have a list of questions that we have received from folks online, and I'll just start. This is from John from Greensboro. What happens if I move from one state to another during the year and the plan that I am enrolled in from my current state is not available in the new one? Jordan, I'll start off with you on that one.
Well, so it would be a matter of the particular context, but really they're looking at a trigger event that would qualify them for new coverage. And so when they're looking at that new state, are they applying for individual coverage or are they going to be covered by a new employer? If they're covered by individual coverage, they would want to work with an assister. They would want to work with someone that could help them through that enrollment process, explain the plans that are available to them, the subsidies that they might qualify for, and the services that they could access for their family.
And the American Care Act, that still transfers no matter which state you go to?
Yes, so the Affordable Care Act, some states have a little bit different website that they use. It depends on the state, they might have their own. But if you move from state to state in the middle of the year, you want to cancel your old policy and purchase a new policy for yourself and your family in your new home where you're living.
Okay, our next question is from Karen from Goldsboro. What are my options if my husband loses his job mid-year? Can I get a discount or subsidy on my policy at that point? Mary, I'll go to you for this one.
Sure. Yes, if your husband loses his job and there was health insurance through that job, then a loss of health insurance qualifies the person for a special enrollment period. Whether or not they qualify for financial assistance depends on a host of factors, including the household size and their income. Soria mentioned that there is such a thing as having too low of an income to qualify for financial assistance. So we encourage folks to go to healthcare.gov and explore their options or work with an agent or a sister or navigator to make sure that they understand what their options are.
Yes, and they have 60 days from the day her husband's insurance ends to enroll for new insurance on the marketplace if they're going to buy it individually for themselves there.
And I know we're talking about like the husband being out of work. How does this impact the children that you're trying to insure? What happens to them?
Well, that's a good question. Again, it's about checking with healthcare.gov or whatever websites in that particular state to see if they may qualify for Medicaid, because in states that expanded Medicaid, those children could be eligible, or they might be eligible for family coverage through the marketplace, and checking out what's available there and what subsidies they might be eligible for is a really good idea to go ahead. And like Sorian said, to look within those time frames is really important.
Okay, the next one is Gary from Asheville. When do I have to sign up for my own insurance if I turn 26? That's something I don't have to worry about. Sorry, and how does that work?
Right, so when the Affordable Care Act was passed, it required that all insurance companies allow parents to keep their kids on until they turn 26. So if you're turning 26, you have 60 days from that event, and when you lose your insurance on your parents' plan, if you were on that, to go to the marketplace and to purchase a plan for yourself. You may qualify for insurance from your employer, and you should also check that as well to see if you could get it from your employer instead. But normally there's a time frame, so don't sit around and wait and worry about it. Go ahead and get help. And again, you can go to getcoveredamerica.org, click find local help, and appointments will pop right up there year round to help people find out what they qualify for, so they can understand the terms. I mean, these are free experts everywhere in the state and in every state of the country that will sit down with people and just walk them through this. So these kind of questions are perfect for that.
Okay, well, the next one is from Maria from Burgaw. What happens to my costs when I travel outside of my home area and the hospitals and doctors are not affiliated with my health insurance plans? Sherry, I'll let you handle that one.
Well, that's another good question. It really depends on the plan that the individual chooses. And that's why all of the panelists today have said multiple times, look at your benefits, act early, understand how to use them, because that really impacts your ability to get care where you want and when you want it for you and your family. So we would encourage that, to look at that, to make a decision and know your benefits, because some plans don't cover outside of an exclusive network. So sometimes they may find that there aren't any costs that are covered, and we certainly don't want that for individuals. And other plans do cover those out of network. And again, that's that word, network, meaning that there are certain groups of doctors and hospitals. Well, if you're really interested in a particular network, you need to look at that and understand how to use that benefit. So take a look. It's complex and it's not always the easiest thing, but we encourage people to get that free help.
Mary, anything you'd like to add?
I may just add that all of our Blue Cross plans have a national network through our Blue Card. So we affiliate with other Blue Cross plans in other states, and our customers can use their network when they travel. So agree completely with what Sherry said. We very much encourage people to check their network before they go to the doctor to make sure that they're visiting someone with whom we have a contract. It's significantly less expensive to visit someone in network.
Okay, and what other issues do consumers need to be aware of before purchasing their health insurance for the year? Jordan?
I think networks are one of the key things that people need to look at. And so that's probably the starting point. Where do you want to receive your care? And then be sure that it covers the services in a fashion that you understand how you're going to pay for it. And so I think that where are you going to receive it? How are you going to pay? How much are you going to pay? And then that kind of informs the decision-making process that consumers will have for the following year.
And we'll leave it here. I would like to thank the entire panel for their time and information today. Again, we have more information on our website. That's unctv.org/health insurance. Thank you and have a very healthy year.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC-TV network.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.